introduce Lisa Asari, the assistant deputy in the Department of Health. And she has like this really long title, so I'm going to let her fill us in on the rest. Go ahead, Lisa. Good morning.
Good morning. I guess it's good afternoon. Feels like it's still
good afternoon. Yes.
Yes. Good afternoon, everyone, and welcome to the recommendations for doulas in New Jersey during COVID-19 ECHO webinar. Really happy to be on here with all of you. As Dr. Campbell said, I'm an assistant commissioner in the department in a division called the Division of Family Health Services. So really happy to be with you all today. I'm also joined by several people that I recognize as part of the New Jersey Doula pilots. And so I want to welcome you, but I also want to welcome anybody who is not directly affiliated with us in the New Jersey pilot project, Doula pilot projects. And I really encourage you just to tell us who you are in the chat box. You know, please give us your name and your email. Because we do a lot with doulas and really want to include you in the conversation. So again, welcome everyone, and I guess we can start with the slides. So let's see if I can. I mentioned who I am and where I work, but today we're going to talk specifically about doulas during COVID-19. So again, please tell us who you are in the chat box if you're not affiliated with the project, and welcome to the New Jersey Doula pilot participants and everybody else. So let me start with what a doula is. In terms of the Department of Health, we really define a doula as a trained professional who provides physical, emotional, and educational support, but not medical support, to mothers before, during, and after childbirth. That is a picture of our former commissioner, who's actually now the CEO of University Hospital, Dr. Sharif El-Nahal. We met him in Camden about a year and a half ago. That is his youngest son, or his son at the time. I think he's had another one, but some of the doulas from the Doulas of South Jersey, Community Doulas of South Jersey. So they came out to one of the First Ladies' family festivals and really participated with us for the full day. But the doulas are really an extension of the patient care team. We really rely on them to really be the liaison, the connection between moms and the health system. And so as much as we talk about what they do during labor and delivery, they do so much more. They really assist throughout the entire prenatal period, for labor and delivery, and of course also assist with the postpartum period, which we think is very important. So we really count on them. The doula pilots really came into being about 2 years ago, even though doulas had been around much longer, and we had done a couple pilot projects at DOH. But we really did a survey. We kind of canvassed the community to really find out from moms and community health workers what some of the biggest barriers were. And one thing that came up time and time again was real social support, and sometimes folks feeling a real sense of isolation and an inability to sort of advocate for themselves and their families. And so we really looked at the literature. We decided to invest at that time into community doulas through these pilot projects, and really kind of kicked off and launched the initiative at that time. Next slide. So what have we done to date? We have an initiative called New Jersey Healthy Women, Healthy Families. It is a DOH initiative. It is funded to the tune of about $4.7 million. It really supports a lot of social support initiatives, such as group prenatal care. We have a fatherhood initiative, a breastfeeding initiative, and then we have 3 doula pilot projects, one in Camden, Atlantic City area, one in Trenton, and the last one in Newark. And so to date, we've actually trained 80 doulas focused on the Uzazi Village model, which is very community-based. They are really community doulas, so they're doulas from the community that serve the community. And to date, they have assisted almost 350 women, resulting in about 252 births. Next slide, please. So we were somebody says, merrily we were rolling along, and then came COVID. And as you all know, COVID has impacted our worlds in so many different ways. And certainly the doula world was not exempt to some of the impacts of the COVID pandemic. We are still in it, and we certainly had to make some modifications and some adjustments to the system based on the threat of COVID. So back in March, fairly early on in the pandemic, there was an executive order that really spoke to labor and delivery and what would happen in that venue. And it spoke to the restriction of just one support person that could accompany a mother into labor and delivery. That determination was based on information that we had at that time, and it was really based on the environment at that time. So that was a time where there was limited testing and limited PPE. And so at that time, the one support person could be a spouse, a partner, a mother, a doula, or anyone else, but the doula was really counted and potentially considered to be that one support person. Since that time, a lot has happened. I think it's been a pretty traumatic period. It's been a period of loss, but we continue on. And so since that time, the situation has shifted and continues to evolve every day as we read the news and see what's going on in the world around us. And so on June the 29th, we had a new executive director that came out based on the fact that there was additional testing and there's additional PPE. It was felt that indeed the recognition of the doula as part of the patient care team should be put back into place. And we exempted the doulas from the limit on the support person. And so now a woman is allowed to have one support person plus her doula, if that is her desire. And so doulas can accompany the mother and the designated support person for the mother's hospital stay. And this is because there is additional testing and additional PPE. But saying all of that, we really wanted to put together this echo today as a way to really balance the balance access with safety, because the truth is we are still in a pandemic, and there are things and precautions that we should be considering and things that we should do to protect the health and safety of everyone. I know there was a lot of discussion over this last several months, but the first executive order was really established for everyone's safety and well-being. And as much as we have revised the directive on June the 29th to allow the doulas back in, we still want to be so cognizant of health and safety of everyone. And so there's a couple of things that we'll be talking about today. We have a wonderful doula from the SPAN team named Elizabeth Taylor who will talk next. And she will really describe being a doula in an in-person environment and also being a doula virtually, because that's what she has had to do over the course of this pandemic. And then we will hear specifically from Dr. Damali Campbell, who is an OBGYN. She wears many, many hats. I'll let her introduce herself, but she's also the executive lead on the Maternal Care Quality Collaborative that comes out of the New Jersey Department of Health and comes out of the state of New Jersey. And so she'll talk to us specifically about PPE and some of the considerations and things that we should do. One of the things that I will say though is you can help us. You can help us in ensuring the health and safety of everyone by reinforcing some of the messages. I think some of the things that we're hearing about is testing. And a pregnant mom sort of being tested. The testing doesn't have to happen at labor and delivery. It can happen before that. And then I would encourage you as doulas to be tested as well. Because some of the things that we're hearing is that it's really about the health and safety of everybody. And so I think that everybody would feel better if we knew of people's sort of COVID status prior or as much as we can. And so that we can make the necessary steps happen when we get into L&D. So we consider you a partner. We thought it was important to speak to you at this time because the directive was just so recently changed. This is not the one and done conversation. I hope to speak to you all again in a couple of months or in the early fall, because I don't know what we can anticipate is kind of coming ahead of us, but I think it's important for us to stay engaged. And so for anybody that may have joined since we began, I really ask you to just tell us who you are in the chat room. Much of the work that we do is very focused on the New Jersey Department of Health doulas from the doula pilots, but by no means do we have access to the full universe of doulas out there. And so you may know, some of you, that we are in conversations with Medicaid in terms of the reimbursement of community-based doulas. And so we would like to keep you updated as that conversation is moving on. So I encourage you to stay connected with us. Next slide. So I will stop here, and I will, as I said, pass it over to Elizabeth Taylor, who will talk to us about doula support provided both in person and virtually. Thank you.
Excellent. We can go to the next slide. Hi, everybody. I'm Elizabeth Taylor, and I'm going to be talking to you about doula support in the era of COVID. I'm a doula from Sister to Sister Community Doulas of Essex County. I am a certified full spectrum doula, which means I specialize in prenatal, birth, and postpartum support, as well as childbirth education and lactation. Before we delve into how doula care has changed during the COVID-19 pandemic, I thought it best to explain what a community doula is and why doula care is important to women's health care. You can go to the next slide. What is a community doula? A community doula receives a certification through an evidence-based, community-centered model. We work with women of color and low-income families that would otherwise not be able to afford doula care. Our goal is to address inequities and implicit biases within the healthcare system to mitigate the risk of adverse birth outcomes. We do this through education, advocacy, and support. As an integral part of women's healthcare, we work together with midwives, doctors, and nurses to provide moms with continuous support and education. It has been proven that women who receive doula support are less likely to have a cesarean birth, need medical interventions or pain medications, and overall say that they are satisfied with their birthing experience. We can go to the next slide. Okay, so we are lowering the risk for preterm birth, cesarean sections. What we do is based on tried and true techniques and evidence, and we're all about you, the mom. That's our center, is to make sure that along your pregnancy journey, we are there from conception to the 4th trimester, which is known as postpartum care. Next slide. Okay, so our care model consists of prenatal visits with the mother, uninterrupted birth support, and postpartum visits. Prior to COVID-19, we were able to have home visits and in-hospital visits where we were able to provide physical support in terms of comfort measures. A comfort measure is a technique used by doulas to help alleviate pain, discomfort, and promote relaxation. Next slide. So during COVID-19, we've had to shift our model of care from in-person to virtual. There have been several challenges that have been presented with this shift. Number one, there's a decrease in intimacy. Obviously so, right? Because we're contactless. And you know, when you're caring for a pregnant mother, it's a very personal journey. It's a very intimate journey with this mother. And when you're having your first conversation over FaceTime or Zoom, it creates like an impersonality and kind of a distance. So to combat this, we just make sure to be readily available whenever the mom needs us and to increase the level of communication and visits that we have with the mother. Number two, like we said, there's no physical contact. And being a doula is very physical, right? So an example, we provide a technique with a tool called a rebozo, where we do an abdominal lift, us the doulas. And what this does is it alleviates pressure in the abdomen for the mom, low to mid back pressure, and vaginal pressure. So, there's nothing like somebody else coming and taking the weight of the baby for you for just a moment to give you that relief. Now, switching to contactless comfort measures, I'm going to give you the example of, we would have the mom stand up, put their back against the wall, and probably your feet are out in front of you a little bit hip width apart. You take your fingers, you interlace your fingers and place them under your abdomen, lift up and into yourself, and take some nice deep breaths. While this does the same thing, it is going to alleviate some abdominal pressure, lower back pressure, and vaginal pressure. It's really not the same as your doula coming to do that for you. Some other ways that we provide contactless care are through sending YouTube videos, because as descriptive as you can be with walking someone through how to do a comfort measure for themselves, there's also nothing like seeing a step-by-step tutorial. I personally have created tutorials along with my doula sisters, and we also do webinars on different topics to kind of bridge that gap of contactless support. Number 3, another challenge is we're limited by technology. So when you're providing virtual support with a mom and you're going into the hospital and you're on FaceTime, if the cell phone service goes out, well, you're losing that connection and they're not able to hear the verbal support that you're providing. Or, also if the cell phone dies, right? So we're limited by technology in that way. So I just want to share a brief story with you about a mom that just gave birth to a beautiful baby in the middle of June, a baby girl. So we talked during our prenatal visits about her aunt being the in-person support person that she would have. This is during the time when there was, only one support person allowed. And I would be there on the phone virtually with her. So she goes in, she's doing her COVID test because they have rapid testing in the hospital, and it was identified that she was COVID positive. And her aunt, being an older individual, had to, or felt it best to leave and go and immediately isolate herself. So she went from having her aunt, who had been there for her previous birth, to support her physically, and me virtually, to just me virtually. And while we rocked it out, along with her nurse and her doctor, and she will tell you that she had a very positive experience delivering. It was definitely challenging in that she had to deliver with, of course, a mask on because she was COVID positive. And she did not have, I guess, the number of people that would be there in terms of, we're trying to limit exposure. So she had one nurse and one doctor that were with her the whole time. But we are able to combat some of the limits imposed by the COVID-19 pandemic by just really, keeping the lines of communication open. So personally, I'm very grateful for this executive order that we're able to come back into the hospitals and provide that physical support for our patients. In my doula bag pre-COVID, I have these glasses, which are not prescription glasses. They're just like eyewear to like prevent anything getting in my eyes. And I have gloves, right, normally. Now, with COVID, I also have my face covering and a face shield. But I'm really looking forward to Dr. Campbell explaining how we can provide safe care for the moms that we're working with, and how we can keep ourselves safe. So next slide. Should you like to request doula care, you can email us at communitydoulas@spanadvocacy.org. And I will turn it over to Dr. Campbell. Thank you.
Okay, thank you, Lisa, and thank you, Elizabeth. My name is Domalee Campbell, and feel free to call me Domalee. I am an obstetrician gynecologist with over 20 years of experience. And in addition to working here at Rutgers, New Jersey Medical School, I also was recently hired as the medical director for the New Jersey Department of Health Maternal Care Quality Collaborative. I'm joined here by my colleague, Dr. Natalie Roche, and she is also an obstetrician with far more experience than me.
She's trying to say I'm old.
And so she's going to help us. I do want this to be interactive, and I really appreciate the fact that everybody has been chatting their name. I also, if you have hand sanitizer close by, I want you to get that close by because we will need it. I'm going to be asking questions and asking for you to respond. So I know that we have mostly doulas on this call, but we also may have some other non-clinical workers who work with clients. And, you know, as you all already know, I don't want to preach to the choir. We are working with community members, and many times you are really the source of trusted information to our patients. Many times you serve as a liaison and an intermediary between social services, between medical services, and between community members. And I cannot, you know, overemphasize your importance because it really is team. It's a team effort because I have my role and you guys have your role. So you folks have your role. I don't want to say guys. So many times you help facilitate access to care. And it's extremely important that you have accurate information so that you can not only transmit that information to clients, but also to your peers. Because you all know, just like any other information, sometimes we tend to work in silos. Something's going on, some people know about it, some people don't. So again, I can't thank the assistant deputy commissioner for putting this together so that we can get all the information, and hopefully you'll be able to share this as well. I think this is an opportunity for us to show how we can work together, and we'll go to the next slide. So just as a matter of a brief review, you know, coronavirus, you hear this term, COVID-19, SARS-CoV-2, novel coronavirus, and what does that all mean? So, you know, actually, coronavirus is a family of viruses that cause respiratory illnesses. And just like they have symptoms very similar to the common cold, and they have been around since the 1960s, there are many different coronaviruses that affect animals, but there are 7 specific ones that affect humans. And the clinical presentation can occur anywhere from 2 days to 14 days after exposure to the virus. And so that's going to lead us to some of the recommendations that we're going to hear about. Infants and older adults and persons with underlying medical risk are particularly susceptible to SARS-CoV-2. That's the name of the virus. COVID-19 is when you have illness from SARS-CoV-2, okay? And so we have here, again, we are most commonly aware of the respiratory illness, like pneumonia and cough and fever and chills, but there are other symptoms that can be present, like muscle aches, body aches, diarrhea, nausea, and vomiting. And for some folks who have had nausea, vomiting, diarrhea, and fever, they may not have cough, they may not have shortness of breath or difficulty breathing. So there are people who can have a constellation of these symptoms, a mix of these symptoms. They don't necessarily have to have just one, or they don't have to have them all. Fortunately, 80% of people who actually get the infection, who get the virus, will be either asymptomatic, they will not have any symptoms at all, or they will have very mild symptoms, maybe a stuffy nose, maybe a cough, but they will have mild symptoms. So that means that 15% of folks will have more moderate illness. So those may be the people that have fever, and severe shortness of breath, difficulty breathing. They may need to be hospitalized. And then a small amount, fortunately, suffer with severe illness. That's 5% suffer with severe illness. And these are folks that end up needing to be admitted to ICU and unfortunately end up needing to be on ventilators. Pregnant women are not more likely than others to particularly to coronavirus, but in general, we see that pregnant women, we recognize that pregnant women are more susceptible to infections in general. So there's no, when we're pregnant, we're not particularly more susceptible than infants or other people to coronavirus, but pregnant women in general are considered a high-risk group, and they are considered susceptible because when we are pregnant, our immune system is slightly lowered. We are carrying a baby who is not only part us, but it's part someone else. And so that's why our immune system is normally lowered. And so in pregnancy, we normally are a little bit more susceptible to particular viral illnesses. And during pregnancy pre-COVID, we don't recommend that pregnant women go around people who are sick. Okay, that's usually a general recommendation. And of course, we are all unique, and so there are some pregnant women who are going to be higher risk than other pregnant women who have diabetes, pregnant women who may have lupus or other immunocompromising conditions, pregnant women who are obese. Next slide. Okay, so how does coronavirus spread? Most commonly, coronavirus is spread through contact with respiratory droplets. Coughing, sneezing, laughing, particularly coughing and sneezing because they can further how far those respiratory droplets. In our normal speech and talking, we have respiratory droplets that are in the atmosphere. But of course, when we cough or sneeze, then those respiratory droplets can go further. If we're singing, if we're shouting, those things again can make the respiratory droplets go further, okay? If we happen to yawn into our hands and then we shake someone's hands, then of course through the shaking of hands and close contact like touching and hugging, kissing, we can spread the virus. And of course, if we do sneeze and our respiratory droplets land on a table or on a doorknob or on a chair, and someone comes behind us and then touches those objects or surfaces and then touches their own mouth or nose or eyes, then the virus can be spread. I wanted to show you this pictograph. I know it's in Spanish, but it reminds me that there are many resources, particularly from the Centers of Disease Control, CDC, and those resources are not only, they're in different languages and they're available with a lot of pictures, which is great for populations that have low literacy levels. And when we talk about people who have health conditions, we're talking about people who are at higher risk. We're talking about people who are older than 50, people who have lung disease, for example, moderate to severe asthma, heart disease, other serious heart conditions, a weakened immune system from cancer, even if that cancer was treated in the past, obesity, diabetes, kidney disease, and liver disease. Those are all conditions that can make our immune system weakened. Next slide, okay? And so there are things that we can all do to prevent the spread of COVID-19, right? Avoid exposure with people who are sick. And if we're sick, we stay home ourselves. Many times, sometimes we don't have the luxury to, we think we don't have the luxury because we may be the breadwinner of the house. We may be, we think that work cannot go on if we're not there, right? I know that feeling very well, but it's actually, we can do far more harm when we go to work and we're sick. Washing our hands very often, okay, covering our nose and mouth with a tissue or in an elbow if we do have to sneeze or cough. And don't touch your eyes, your nose, or your mouth with unwashed hands. At this time, we're talking about creating more space, being a little bit more physically distant, and wearing a face covering. The face covering has to cover your nose and mouth to be appropriate. And particularly, we want to do that when outside of your home, especially if you can't maintain 6 feet of distance from others. You go to the grocery store, they're only allowing a certain number of people in, okay? But, you know, even though they have all these markers to say 6 feet away, people are coming down the aisle. You can't really control how close somebody's gonna get to you. And thus is the reason that we're recommending the face covering when you're out in public. And then clean and disinfect frequently touched objects and surfaces. Next slide. So in our medical community, you know, hand washing is the single most important thing that one can do to fight the spread of infection. And it's really important that we do it often. And we have to think about important touch points, washing our hands before we touch a patient, after touching a patient, and after touching any equipment, okay? The length of time is really important. 20 seconds or even more, okay? And if we don't have access to soap and water, using a hand sanitizer that has at least 60% alcohol, and again, for 20 seconds is the key, okay? And so when you are washing your hands or using hand sanitizer, it's important not only to get the palms of our hands, but also to get in between the fingers and the back of the hands. Okay. And, you know, we talk about the proper way to wash your hands is actually to wet your hands, lather your hands, and the washing part is supposed to take 20 seconds, and then being sure to rinse and dry. And so, you know, there's a number of different ways. You can sing the happy birthday song 2 times. With the kids, I have them sing ABC. You know, there's many other ways to emphasize that length of time. So I want to show you a video that, because I can't emphasize this hand washing enough, this is a virus, our coronavirus molecule, and it has a layer of fat. And this is what happens with soap as it interacts with coronavirus. The soap pulls the barrier, it demolishes the virus, and the viral particles go down the drain. And the important thing is it takes time for this to happen, and that's why it's so important for that 20 seconds. This is a special soap that was used, and it mimics the virus, the fatty layers, and you can see it under the UV light. It glows. So this is what happens when you wash your hands. You just rinse them. This is what happens when you do it for 5 or 10 seconds. You still have stuff on your hands. But a full 20 seconds, okay, now you can see, you don't see anything under the UV light, okay? And hand sanitizer works well as soap. If you don't have access to water, okay, but it has to contain 60% alcohol. And, you know, just think about when it's hot outside, if your hands are sweaty or sweaty, or you, if you're nervous, then you may need to use it longer, because the hand sanitizer can be diluted and then it would diminish its effectiveness. You know, we walk around buying all these fancy antibacterial soap, not necessary. The FDA says you can skip it. Okay, there's no proof. You just need regular soap and water, and you need 20 seconds. So, okay, everybody has their hand sanitizer handy. We're going to time you so you can really see what 20 seconds is like, okay? And so get your hand sanitizer out, please. and put a pump into your hand. I'm using a hand sanitizer that is 70% alcohol. And so get it into your
Who's gonna
hand.
start the time? You're doing the 20 seconds?
Ashley's gonna start the timer. And so 3, 2, 1, go. And so you wanna make sure you get not only the palms of your hands, but in between, interlace your fingers, get the back of your hands and even those wrists. And so you might be thinking, I'm done, but 20 seconds is not done. Keep going. And we're done, okay? So people underestimate how long 20 seconds really is. And so that's why I wanted to take the time. It dried out. That means you didn't put enough, Tatiana. But thank you. So, and I would encourage you to, do this with your clients.
Remember, I had to take my bracelets off. People forget this. You're not supposed to be wearing jewelry, all right? You have to remove it.
Okay, great. So I think that it's important, we want to talk about what personal protective equipment is. It may be necessary to explain to clients why it's important to wear PPE. And I can tell you, I was in the hospital every day during the height of COVID, and it was really, unfortunate. Because by the time we put on the hats and the masks, basically all you could see is a sliver of our eyes. And, we're trying to talk to patients. We're trying to show them our empathy. And the reality is a lot of that empathy comes from our body language. It comes from our facial expressions. And patients cannot see that when we're all covered up and we only have the little sliver of the eye. I was walking by people that I knew very well, but I didn't recognize them because all I could see was the sliver of their eye, right? So some of the doctors, particularly in emergency room, they had to get big badges to show their faces and show this, I'm the provider that's taking care of you. So, that experience can be very stigmatizing for patients. And so I tell you all this, that it may be necessary to explain to your clients why it's important to wear the personal protective equipment. And, the way I would talk about it is that many jobs wear special clothing or accessories to keep themselves safe, right? If you work on a construction site, you may need to wear a hard hat, or you have to wear a certain kind of construction boot because if something falls, you don't want to get hurt. And so I can't overemphasize, my mask protects you. It keeps my respiratory droplets from going out and getting into your atmosphere. And your mask protects me. It protects your respiratory droplets, right? Because we already said that so many people can have the virus but be asymptomatic. It does not have to be a surgical mask. All it has to be is a face covering, and it does not have to be expensive. You don't have to spend a lot of money. There's a great video on the CDC website, and I've shown people how to make a face covering using an old t-shirt. But the most important thing is that you want that face covering to cover the nose and the mouth.
This is
Okay.
incorrect and seen all the time.
Yes. Okay. So another question that I had, and I will ask you to put, if you don't mind, if you can respond in a chat box. How do you feel about if your client doesn't want to wear a face covering or a face covering? And you'll have to decide how comfortable you are with that. And also, if, in dealing with clients in the hospital, we all have different requirements for our work. So how many of you via your work are annually tested for things like tuberculosis? Okay, because we are talking about COVID, but we have other communicable respiratory diseases that we can be exposed to. And, COVID might cause you to have a cough and a fever. And if you are particularly vulnerable, maybe more moderate illness. But tuberculosis is no fun either. It's 9 months of medication. So there are risks, and we all do take risks. So some folks said they were not comfortable if their client doesn't wear a face mask. But I think that we have to think about how we're going to have this conversation with folks. Okay. So who should wear PPE? So anybody who will be in close contact, which is defined as being less than 6 feet away with a person diagnosed with COVID or a person under investigation. What is a person under investigation? So a person under investigation is a person who's been tested, but we don't have their test results back, okay? Or a person who has symptoms that hasn't yet been tested. So those are what we call persons under investigations, okay? Again, many people are familiar with respiratory symptoms, okay? And, you know, many of us have allergies or asthma symptoms. And so sometimes our clients might think, well, I have allergies or I have asthma. And so this is just, you know, what normally happens. But I would encourage folks, even if they have allergies or they have asthma symptoms, because that they should be tested if they are having a persistent cough, particularly if they're having fever. They should speak with their provider about being tested. Because what we would hate to happen is just to put it and think, oh, it's allergy, it's asthma, and it's really COVID-19, okay? The longer you're around someone, the increased risk of exposure. And so, you know, some of the things that you might want to think about, as Elizabeth mentioned, is limiting your contact. And maybe, because we know for a first-time mom that labor can be 18 to 24 hours. So maybe we want to limit our contact early on and do more virtual support early on. And then another option is maybe we can spend some time outside where it's easier to be physically distant. The high-risk OB activities is really during the second stage of labor. It's impossible to provide care to a woman, whether it's doula care or whether it's medical care. It's hard to do that from 6 feet away. It's not possible, right? And so when in the second stage of labor, when mom's fully dilated and she's pushing, and for those of you who have attended deliveries, you know the sweat, the secretions that are being exuded. It's horrible to think about a woman having to go through the second stage of labor where they're pushing with a mask on. It's, you know, sometimes it's just not possible for mom to do that, as much as medically we might be telling her to do it. It's crazy. She's trying to push, she's sweating, you know, it is difficult. But the times that the high-risk activities that we have to really be aware of is the second stage of labor while mom is pushing, and if mom has to go to the operating room, particularly if she has to be intubated. And that's always a possibility when we're doing surgery. So the PPE that's normally worn in the healthcare setting, so there is the surgical mask, which we have a picture of, and there's different types. Dr. Roche is holding one that you can self-tie. I'm holding one that has ear loops, okay? And then there's one that has a face shield that's attached, okay, which can be covered under your eye protection. And then this is what an N95 looks like. And that's a different N95. So I want to talk about the N95s a little bit, because N95s need to be fitted, okay? There's a special procedure where you fit the N95. They actually spray something to make sure that there are particles that you're not smelling or tasting when you wear this. It makes sure that you have a good seal or a good fit. So unfortunately, you know, just kind of going on Amazon to purchase an N95, if you're not sure how it fits and if it's going to offer you the perfect seal, may not necessarily be the best, okay? There are also these one-way valve masks that a lot of people are wearing outside of the hospital. I know in our hospital, University Hospital, the employees have actually been asked not to wear those masks because the fact that it has a one-way valve, and the reason that it has a one-way valve is because it makes it easier to breathe with the mask on. But the simple fact that it makes it easier to breathe means that the respiratory droplets are coming in and they're going out. And so it's not offering really any protection. There's the eye protection. So we mentioned the different types. There are goggles, there are things that are attached to the mask, and then there are face shields, and then there are gloves, and then there are gowns, and then there are head coverings, and there are various types of head coverings, okay? It would be my suggestion that if you can, you would consider bringing your own PPE in case the hospital doesn't have enough. I know Lisa mentioned that part of the reason the executive order was issued is because the hospitals felt that they were going to have enough PPE. I would say particularly like things like a head covering, you know, it doesn't have to be anything fancy. You can get a scarf. These head coverings are not particularly durable and they don't necessarily fit everybody's hair type. So for something like a head covering, you may want to bring your own scarf to be able to pull your hair back or to cover your hair. And you can always get a bonnet from the hospital, and then that would, you know, kind of go on top of your own hair covering. I will, before we end this, I will also put in the chat box my email, because through the New Jersey Medical Association and the New Jersey Association of Black Women Physicians, we do have some cloth face masks, and I'm happy to distribute those to folks, and I'm happy for you to help me to distribute them to community members. And so if you email me, we can connect on how to get that done. I know there's a couple of things going on in the chat that are flashing by about whether their mom was made to wear a mask or not. And every hospital has different policies. And I think, you know, I'm a mom who gave birth 3 times in New Jersey. Many of the nurses have given birth. So, you know, I recognize, yes, the rule says you're supposed to wear the mask through the 2nd stage of labor. I don't make my mother wear the mask during the 2nd stage of labor because I think that for some women, they're not able to do it. And it's a little bit crazy, but that's not a medical recommendation. That's my own personal recommendation, being a woman, having given birth, okay? And so you are gonna find some different policies from hospital to hospitals. Surgical masks are generally provided at the entrance of most hospitals where you get a temperature check. And on L&D, once mom is admitted, you'll likely get a temperature check done again. The policy for the vast majority of hospitals have been that patients are able to have their visitor, they're able to have their doula as long as they are symptom-free from COVID. And so the way they're checking for that is just checking for temperature and asking if you have any symptoms of cough or fever or any symptoms of COVID. And again, on L&D units, and each unit's going to be different. I cannot speak for every single hospital, but I know that for our hospital, the mask and face shields are usually available. And as long as the stock allows, then the arrangement has been made with the Department of Health that the hospital will provide the PPE to doulas. Okay. I wanted you to know, because somebody specifically asked about head coverings, and there has not been any known transmission from hair, but the fact of the matter is that many times we may touch, you know, we may touch our hair, and that's why there's that recommendation for head coverings. Okay, just gonna keep going because we are, so when are we going to wear PPE? If the patient is COVID positive or the test results are not back, or if the patient is symptomatic but declining testing. So times that you might want to consider taking extra precautions. If the patient declines testing, I have seen patients decline testing. And you know, my thing is, why is the patient declining testing? And I think that's something where as liaisons, you can certainly bridge that gap and find out why. Usually when the patient's declining something, maybe it's because of the fear, of discomfort of the testing, discrimination or stigma, which we certainly know exists, or they had a prior test and they don't feel it's necessary, but they may just decline because they want to decline. But I think I wouldn't leave it at just the patient's declining. I would want to ask them why. If the patient is COVID negative, but is coughing and have other symptoms, any test in the world is not 100%. All tests have what we call false negatives and false positives. And so that means that somebody could have a negative test when they actually have COVID. That would be a false negative test. And somebody could actually test positive when they don't have COVID. That is the properties of all testing. And so, if the person has serious cough, fever, but they're COVID negative test, I probably, would still take some precautions. And if you, as, a support person or you have a family member at home that has a medical condition or you're particularly vulnerable, those may be other reasons that you might consider taking extra precautions. I think, when you if you do make home visits, I would recommend calling ahead and making sure that no one at home is sick, and at minimum, wearing a face covering and asking the patient to wear a face covering. And in the hospital, we are going to recommend PPE in the situations where the patient is COVID positive or a person under investigation. Okay? So I would, urge you, I know you guys are from all over the state, you folks are from all over the state. Most hospitals, I think I said this already, are going to be requiring temperature checks upon entry into the building. They're going to be requiring face masks to cover the nose and the mouth. Each hospital has different timeframes for when test results are going to come back. Some come back very quickly and some may take longer. So probably you want to have a conversation with your clients about, are they going to call you when they're on their way to the hospital? Are they going to call you after they get their COVID test result? I do want to have a conversation about, as a medical provider, I can't really tell you the patient's COVID status, right? So it's up to the client. That's still protected health information. So that's something that you kind of want to discuss with the client, right?
And I'd like to intervene here because as healthcare providers, we can't actually even give the COVID test with the doula present. The patient has to have privacy for those results. Sometimes we'll be giving HIV results, tests for syphilis, whatever. So sometimes the doula will be asked to leave the room, but it's really about these privacy issues. The patient can't necessarily know they want you to be present because they're anticipating a negative result. If they get a positive result, then it may be a whole nother issue. So occasionally, we definitely, when we're giving test results, we'll have to ask the doula to leave, give the results, and then the doula can return to the room.
Yeah, so I think it warrants a conversation. If you can have that conversation prenatally about how you're going to work that out. And of course, these guidelines and guidance are changing often, and so it can be really hard to keep up with. So I think it's, would be fair to say, check with your labor and with the hospital that you frequently go to, check about any specific changes in their L&D policy or any updates. And don't necessarily assume that they have read the executive order that was recently issued. So they might, need to be re-informed of that, okay? So why are we doing, next slide, why are we doing all this? Okay, it's all about safety for patients and their families, safety for hospital staff, safety for community members, and safety for you, right? Because this is your life, you're balancing your safety as well as a small risk. And we all take a small risk, right? I mean, this is life, okay? But we want to balance it, and we have to take care of our own selves. We have to take care of our own families. So we want everybody to be safe. So how to put on PPE, okay? So we talked about the different types of PPE, and we always want to start with hand hygiene. Then we put on our isolation gown, and then we put on our face mask. If we're dealing with a COVID positive patient, the most useful is the N95. Someone asked about the KN95. It's not as useful as the N95, but it's a substitute. And you may have heard in certain places there were shortages of N95. And so we use the KN95, or we use a surgical face mask, or we use a face covering. So some covering is better than no covering, but the one that provides the most complete protection is the N95, okay? And so it's important with this N95, which, as I told you, is normally a fitted mask, to make sure that the nose piece is molded to the nose and that there's a good seal. So if you blow out, you shouldn't have any air that comes from the side of this. So that's the importance of being fitted for this.
But they should not have an expectation they'll be given an N95 in the hospital setting. All right, I just want to repeat, you have no expectation you'll be given an N95 in the hospital setting, because you have to be fitted for it. And not being a hospital staff member, there's no opportunity for you to be fitted.
So I think, going forward, that's probably something that can be discussed with the department about getting fitted and things of that nature. But at this time, probably as was mentioned. But the surgical mask, okay, again, offers also some degree of protection. Also the face shield or goggles. And then again, you want to use hand hygiene and then put on your gloves. So we have a short video just to show you how to do that. So somebody asked, how would the healthcare provider say, handle the patient saying it's okay for the doula to be present for their results? So, it's like if I want to ask the patient about domestic violence and intimate partner violence and their partner is there, they can't really give that type of consent with their partner being present. If I have talked to the patient independently and they've told me, I need the doula there, and you can discuss any and all test results with them. And at that time, I can question them. Does that mean COVID results, HIV results, STI results? And they're able to consent to that independently, then I think that would be fine. But I can't ask the patient that question while the doula's in the room, because, that's not really, that's considered coercive, okay? I'm not sure our video is working, so we're gonna go to our plan B, okay? And so plan B is, we're gonna have a live demonstration, okay? And so again, first thing is going to be my hand hygiene. Okay.
You already have your hair protection.
I already have my head protection on. And so now I'm going to put on my gown. In this particular gown, every hospital has different gowns. So again, feel free to talk to the nursing staff. They can observe you putting on and they can assist you. But this particular gown has a head loop. And so I'm going to put the gown on, the head loop, put my arms through. This particular gown also has a place for my thumbs, okay? Then I'm going to put on my mask. And even with the surgical mask, I'm going to make sure that my nose, the piece for the nose is molded, okay? And that it's covering my chin, okay? After I do that, again, I'm going to do my hand hygiene. And then I'm going to put on my gloves.
She's making sure that the wrist part of the glove goes above where the gown ends.
Okay. And I did, anybody know what I did wrong? What?
You didn't tie your gown first.
I didn't tie my gown, but I don't have on my face shield. So that's because normally I wear this type of shield with the mask, but I thought it was easier to put this one on. So again,
Get somebody.
normally I would put this on instead of this one without the eye protection. I would put on the one with the eye protection, but all the other steps would be the same. Okay? Any questions? We'll unmute for a minute to see if there are any questions.
This is not, we don't expect you to see one little demonstration and remember how to do this. When you go to the hospital, you have a general idea what you have to put on. Just ask the staff there and they will assist you in terms of making sure that you're putting your personal protective equipment on properly in the right sequence, and also can remind you how to remove it appropriately, which Dr. Campbell will show you next.
Yep. Next slide.
Thanks, Dr. Campbell and Dr. Roach. This is Lisa from the Department of Health. One of the questions that came through is, are the doulas allowed to leave the hospital and come back?
It's my understanding that they're asking people not to leave the hospital.
Okay.
Okay.
Another question that came in, how do we build partnerships with hospitals? You know, what advice would you give to doulas who want to figure out how to connect better with you?
Yeah. I mean, again, I gave my email. I think that for different, I think what I would suggest if I were in that situation, I would start to speak to the head nurse, to, the leadership, and say just that, I'm looking to build a partnership. And, how can we do that? What are the opportunities that we have to do that?
Yeah, and I would just say from the Department of Health's perspective, we're looking to do that across the state. And so I really encourage the doulas that are on here to really give us their email information. We've sort of begun doing that with a few pilot sites, but we really need to do that more on a statewide basis. Tell us who you are before you leave.
So if I could add, I know that I was asked about breastfeeding and PPE. I read, and I'm sure Dr. Campbell, you can speak more to this, but I did read on the CDC site that as of right now, it's not thought that the virus is spread through breast milk, and that breastfeeding is okay. And as long as mothers are washing their hands prior to breastfeeding and wearing a face mask while breastfeeding, that would be okay. Can you speak more to that, Dr. Campbell?
Yes, and I have a slide coming up. So we certainly want to recommend breastfeeding. Absolutely. Okay, so we're just gonna go on to just removal, okay? And so the first thing that we want to do is remove our gown and our gloves in the patient's room. Okay, that's very important. The gown and the gloves get removed in the patient's room. Again, so you have different gowns. Some of them will have the neck loop, some of them won't. So you'll have to kind of pull it. And then what I usually recommend is to take the gown and gloves off together. And so then you kind of just fold it up, and you notice how I'm kind of doing this away from my body. So I'm not touching it. And then it goes into the garbage can, inside the patient's room. Okay, I step out of the patient's room and I do my hand hygiene. And we're gonna say it's 20 seconds now. Okay, and then the next thing I'm going to do is remove my face shield. Okay, and then I'm going to remove my surgical mask. And if I have the ear loops, I'm going to just remove it away from my face. And again, this will be discarded outside of the patient's room in the garbage, okay? Some people do wear 2 gloves, so if you have on a second pair of gloves, you would still have on a second pair of gloves, and you would remove those gloves and then perform your hand hygiene again. And so, you know, when you do this so many times, and this is just for one patient, so certainly if you have to do it for multiple patients, this alcohol hand sanitizer can be very drying to the hands.
And then you have to replace with a new mask.
Yes, so when if you do leave the room to go to the cafeteria or go to the gift shop or go to take a phone call, and then you're gonna go back into the patient's room, you're gonna need to use all new equipment again. You don't wanna reuse the same equipment again.
And then just a reminder, you're required to have on face protection in the hospital. So when you take your face shield off and wash your hands, you have to replace it with a new face shield just to walk around the hospital and be present in the institution.
Correct. And that face shield doesn't have to be the surgical mask. That can be your own cloth mask that you brought from home. Okay, next slide. Okay, so post-delivery procedures should be quite similar to pre-COVID. Again, there's always going to be some hospital variation, and the place of care is really designated by the mother and the baby's medical condition. I know early on in March, when things were changing on a daily basis, there were reports of moms who were being separated from their babies when they were COVID positive, even though mom and baby were fine, but that should not be happening anymore. If mom is COVID positive and the baby is full term and the baby is healthy and doesn't require ICU care for anything else, if that hospital has rooming in, then mom can room in. If mom is COVID positive, we are teaching mom about separation, but it's an opportunity for us to educate mom and the family, because when they go home, they may not be able to have 6 feet of separation. So we need to find out what their circumstances and what their conditions are and give them the best practices. Breastfeeding is medically recommended and should be encouraged. It's one of the most important health interventions that we can recommend for our moms. And so if there's no medical contraindication, and there are very few medical contraindications to breastfeeding, we should be doing that. If mom is COVID positive, then we're asking her to wear a face mask when she's feeding the baby. It is not necessary for mom to wash her breast. And, you know, in general, mom, family members, caregivers should be washing hands. Pre-COVID, we should have been washing hands, right? So this is not anything new post-COVID, but the face mask if mom is COVID positive, okay? Some hospitals do have an early discharge policy. At this point, I know for our hospital, University Hospital, since things have kind of whittled down, patients have the option of going home early, but they can also stay for the full 2 days. So if that's something mom is interested in, she should definitely ask, okay? We have noticed, particularly in April and early May, when we had a lot of early discharges, that there was limited breastfeeding support, particularly because most of the offices are closed and so many of us are working remotely from home. And so I think, you know, clients will definitely need their doulas, not only for the labor comfort, but for the support that you all offer, you know, postpartum with helping mom to breastfeed, and they may even need, you know, more lactation support than they needed in the past. They may have, more anxiety. This is some of the things that we noticed, but also food insecurity and stress management issues because of loss of income and different things. Next slide. Okay. So, my final thoughts and questions is basically safety first. In terms of building partnerships, reintroduce yourself. Don't assume everyone's aware of the new executive order. Find out what's new with the hospital policies. And I think that's the perfect segue. Hi, I am Doula, I'm a wannabe doula, and I want to find out what's new with the hospital policies and procedures, and how can we build this partnership to really make patients the center of our care, because that's what it's really all about, is the patients, the women, okay? And how would I be able to get my PPE? Who do I talk to? And those type of particulars. And I want to emphasize that taking off the PPE in the correct manner is just as important as putting it on. And ask for help, because as you saw, I did the whole thing and forgot my face shield, right? So I'm doing this every day. So sometimes we think it's automatic, but don't hesitate to ask for help. Next slide.
And when people correct you, because they will come and say you're missing this, you don't have your face mask on, just take that in the spirit in which it's given. It's not a hostile, kind of issue. It's not directed at you because you're a doula. Is that we're reminding people everywhere in the hospital who are walking around with masks, under their chins like this, or, like this, to please, proper, use of the mask, that people are walking around without masks, they're taking them off and forgot to put new ones on, that they have to have a face covering. So these gentle reminders are things that should be happening everywhere in the hospital setting to make sure that everybody is appropriately, using their face covering.
Okay. So again, we have a little interaction. In which picture is the person wearing the face mask correctly? So you can answer in the chat box. Is it picture A? Is it picture B? Is it picture C? Or is it picture D? Awesome. You guys are a quick learn. Okay, great. So yes. So picture A, we can see that her mask is covering her nose and her mouth, and all the other pictures, that's not happening, and that's why they're incorrect. Next slide. So again, just a reminder that there are lots of resources on the CDC. Those resources are in Spanish and other languages. There are a lot of PSAs geared towards various community members. There are lots of stars who did music videos about hand washing and social distancing. One of my favorites is with Dougie Fresh, and we can't show it, but you can check it out on your own. And I would encourage you to use those tools and other tools that you may have in your armamentarium to really connect with the clients that we're all trying to take care of. I really appreciate your time. I really appreciate your attention, and I appreciate the comments. And this is an ongoing conversation. So it's not a one and done, as Lisa said. Share this information. These are the references that I use for this presentation. And we have questions, and Dr. Rocha is going to wrap us up.
Well, I'd just like to say that, COVID-19 is a major problem, but it's also a wake-up call for us to address some of these issues about infection control and disease transmission that we may not have had very high on our radar. We all have to ask ourselves, we're required in the healthcare setting to have a PPD annually to make sure that we're not transmitting tuberculosis around. So the question each of the doulas has asked, if you're in an organized doula program, they probably have some of these requirements, but if you are working as a doula, as a private doula, then you have to address these issues yourself. Is your flu vaccine up to date? Because soon the flu vaccine will be out, and we understand that COVID-19 plus the flu are not a combination that anybody wants to have. The outcomes are much worse with flu at the same time as COVID-19? Is your MMWR up to date? Is your DPT booster
That's a
up to date?
vaccine.
These are all vaccines. Are your vaccines up to date? So it's not only just using this personal protection, but it's also making sure that your own health status is something that will allow you to move into the hospital setting and out again and into clients' homes and out without putting yourself and your family in undue risk. So this is a good time to stop and make sure all those things are up to date. And it is also, something to think about. There's widespread COVID testing now in the state of New Jersey. So the question is, you certainly can, we can't offer any testing to you, but you can certainly afford yourself the opportunity to determine what your own status is. And then you go to the CDC website, if you are an asymptomatic COVID positive person, to determine how many days you have to stay home before you can resume your care for patients. Right now it says 10 days with no symptoms. For the asymptomatic and people with symptoms, you have to be afebrile and without symptoms for at least 72 hours. So you have to keep on updating those kind of things because while we may know the patient's COVID status, all of us people working in the healthcare arena may not necessarily know their own COVID status, except for people like me who already got COVID, all right? Before we were doing face protection and got pneumonia. So I do know what my status is, but many of the healthcare workers may not necessarily know that, all right? So you have to make a decision yourself whether you want to try to seek some testing.
So thank you again for your attention. And I know that, it was difficult with the executive order and the pandemic, and we are still in the pandemic. But our hopes are that as we learn, we can do better, particularly as a second wave. We're faced with a second wave likely later on this year. We can use those best practices to do better for our clients.
And hopefully if we all use our face protection, that the second wave will be very, very small this time around. Because if everybody in the community covers their faces and uses good hand hygiene, we can, and also tries to, try to avoid contact with people who are very, very high risk, we can decrease the likelihood that we'll have another episode like we just got over.
So we are 15 plus minutes over time. I want to respect your time. I really do. Thank you so much. Lisa, you want to close us out?
I do. I just want to say a big thank you to you, Dr. Campbell, Dr. Roche, Elizabeth Taylor, and all the participants. I think this session was phenomenal. The comments are saying this was great. This was very informative. I know when you had the mask on, I kept seeing the letter A, and I was like, this is an A+ session. So I was pertaining it to the session, and it was actually the right mask. But I thank you all so very much. Thank you all for participating. The slides will be available in 24 hours, I understand. And a big thank you to Kathy Dodsworth-Regani, Ashley Figueroa, and the whole team, because this is a great platform. It's not one and done. We will continue to stay connected with you. And thank you to those who have shared your personal information. We'll make sure we get you on a list so that you can get connected to resources. So have a great day, everyone, and thanks again so very much.
Don't forget to ask for your mask. Bye-bye.
We have masks to give away, yes.
Yeah, I'll make sure you get the resource from the Black Women Physicians Association. So thank you for that, Dr. Campbell.
Yes, of course.